Morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, welcome back to Insurance Matchmaking. I'm your host, Matt Libby, and if you listened last week, I talked about the Affordable Care Act open enrollment, which started on November 1st. We're now a week into that enrollment, and we're probably up to our eyeballs with ACA and Medicare enrollment issues. So today, as I promised last week, I'm going to talk more about Medicare today. I didn't talk hardly at all about Medicare last week. So I do want to get going on it. And a lot of times, and even the government is advertising this is the Medicare open enrollment. I wish they wouldn't do that. And the reason I say that is it's officially known as the AEP, the annual enrollment period, because there are several different things that Medicare will refer to as open enrollment. So when you first go on Medicare, and you usually when you turn 65, that month you turn 65, or when you start your Part B, which is when you didn't get Part B in the beginning because you're on an employer plan. So now you're leaving that employer plan and you're going to get Part B. You're in your Medicare supplement open enrollment, or your Part B open enrollment, which means you have 6 months from that start of that first month to choose a Medicare supplement, and you're not asked any health questions. So that's your Part B open enrollment. And I bring that up because, again, as I talked about last week on the Affordable Care Act plans, all of your insurance plans have to be, that are qualified health plans, have to be guaranteed issue. And that's where the Medicare Advantage plan fits that role. The Medicare supplement doesn't, and the reason it doesn't is it's not your insurance. It is an insurance plan, but your health insurance is Medicare. And if you get a Medicare Advantage, your Medicare Advantage replaces your Medicare as your insurance. So that's why it has to be guaranteed issue, and it has to cover the same preventive things that Medicare covers. So you have that open enrollment. And in the first part of the year, and I've mentioned this a couple times, but it's always good to have a reminder, the first 3 months of the year, or the first quarter from January 1st to March 31st, is the Medicare Advantage open enrollment period. It only applies to people who already have a Medicare Advantage. You can choose to switch to a different plan for whatever reason. Maybe during this time period when we're in the annual election period, you didn't change your plan, or you picked a plan and now you're not happy with it. You do have a 3 month, as I call it, you get a do-over. So that's one of those open enrollments. There's an open enrollment, the turning 65 open enrollment. And the reason I mention it, some people, you've heard me say before, some people get Medicare prior to age 65 because they ended up disabled. And after you're on disability for 24 months, then you qualify for Medicare, even though you're not 65. And the reason I bring that up is you can get a Medicare supplement. You have that 6 month Part B open enrollment, and you can get a Medicare supplement with no health questions, because generally if you're disabled, you would be turned down for a Medicare supplement plan, because whatever your health condition or injury that disabled you, they're not going to want to pay the extra medical bill, so they're going to turn you down for that. But that first 6 months, they don't have that option. I usually will recommend my under 65 Medicare clients to go ahead and get a Medicare Advantage. And one of the reasons is your Medicare supplement is going to be very expensive, usually $400 to $500 for a Medicare supplement if you're under 65. In the state of Tennessee, the insurance carriers do have to offer you a Medicare supplement during your Part B open enrollment, even if you're under 65, but they're also allowed to charge you more than they would someone who is 65. So your lowest rate for a Medicare supplement is going to be when you first turn 65. That's just the way they do it. It looks funny when you look at it. It's like you're under 65, it's like 4 times as much, 4 or 5 times as much. So a lot of times that's just cost prohibitive to get a Medicare supplement. And the reason I bring that, you have that turning 65 open enrollment, you get again, I call it a do-over. When you turn 65, you're treated just like everybody else who's turning 65. that you start, basically it's like you start over with Medicare. If you had a late enrollment penalty for your Part D, those things they'll all start over when you turn 65. They wipe the slate clean. It's kind of like a juvenile that got caught for shoplifting, and then when they turn 18, that's not on their criminal record because they did it as a juvenile. So it kind of works kind of the same way. Not that you're a criminal, but you do get to start over and again be treated like you're in perfect health. So I definitely recommend, if you're not in good health, or you're on you get Medicare as a disability, when you turn 65, is really consider going on a Medicare supplement, then not continue with your Advantage plan just because it's a zero premium. As I say in my workshops, Medicare Advantage is pay as you go. So you're going to have all those copays and they add up, and they could be worse, as you get older. And again, if you started out on Medicare because you're disabled, if you don't get a Medicare supplement when you first turn 65, you probably won't be able to get it when you're 66 or 67. So it's if you can afford that, is go ahead and get that plan. Now, I know that the premiums are going up on the Medicare supplements, the premiums are going up on the drug plans, but it still can be a better fit in the long run. So those are some things to look at. Now, one of the things I always encourage my clients are that they've determined that Medicare supplement really is just too expensive for them when they're turning 65. And so they want to get that zero premium Advantage plan. And the great thing is that's going to include your drug coverage too. So that's good there. You don't have that monthly outlay. But I always highly recommend you get a HIP, as we call it, HIP. It's a hospital indemnity plan, and that's a hospital reimbursement plan because those first few days in the hospital, you have some pretty high copays. You have some high copays for ambulance or surgeries, outpatient surgeries, things like that. You can get reimbursed for those plans. And also, the other thing is, if you get cancer and you have to have chemotherapy or radiation therapy ongoing, it's only going to you're going to have to come up with 20% of that, and that's going to go towards that maximum out of pocket on that Advantage plan, which could be more expensive than if you were paying a monthly premium for a supplement. So that's why I would say, if you're not going to get the supplement, spend a little bit of money and get a hospital indemnity plan or reimburse for the big hospital expenses, and get a cancer plan that will help you cover that 20% out of pocket. Plus, most people, if they get cancer, they're going to go where they can get the best treatment. So there's usually travel and lodging and things like that. They're going to add some more expenses to you, and that cancer plan can come in very handy to reimburse those expenses. And the beauty of those plans are they don't go up as you get older. Medicare supplement plans basically are going to go up some every year as you get older, and they can get cost prohibitive when you're 75 and 80 and 85. But if you picked up a hospital indemnity plan when you first got it at 65, and most of the plans from 64 and a half and some of them 70 years old, are guaranteed issue. So they're not going to turn you down. You could have active cancer right then, they would still issue the plan. Now, the one thing, they do have a pre-existing elimination period, so you might not be able to get reimbursement for something that happens in like the first 6 months or the first year you have that plan because of your pre-existing condition. But after that waiting period, then it's going to cover you like you never had it. So it still can be very handy and very affordable and go alongside with a Advantage plan. And then we also have plans that I recommend are what we call short-term home health, because contrary to popular belief, Medicare doesn't pay for those home health aides, the ones that come in and just sit with you, maybe do a little housekeeping for you because you can't do it all yourself. Health insurance does not cover that. There's a lot of different options that we can help fill that gap, and that's something we've talked a little bit on here before, but I didn't want to keep going on that, but that's something to consider, especially if you feel that the Medicare supplement is just going to be too expensive. These supplemental plans I'm talking about are not going to be that expensive. So that's a good way to cover some of those expenses that may come up down the road. One of the things people have against Medicare Advantage plans is you run into things with pre-authorization or issues with they don't want you to stay in the skilled nursing as long as Medicare will cover up to 20 days, but the Medicare Advantage plan wants to get you out sooner. Those things usually aren't an issue for those under 65 folks that are on a disability. Those things seem to be more of a burden for the older members. And that's why I say if you're under 65 and going on Medicare, I recommend you go ahead and get a Medicare supplement. It has some great benefits. You usually get some dental, maybe, over the counter. As long as your doctors are in network, it's probably going to work just fine for you. And then when you turn 65, let's relook and see if maybe getting a Medicare supplement makes more sense then. So that's one of the things to save on some of those costs, because one of the things that a lot of, prior authorizations, one of the things you deal with a lot with the Medicare Advantage, but you don't with the Medicare supplement. And then I also want to cover some of the terms that you're going to run into or hear us say. I've already said some of them. I've said AEP and IEP and SEP, which stands for Special Enrollment Period. So sometimes during the year, you can qualify for a special enrollment period. One of the things that those where Hurricane Helene hit, there's several counties in East Tennessee that have a FEMA disaster SEP now. So we're in the open enrollment period or the annual enrollment period. Because of what happened there in Upper East Tennessee, is those counties, they're basically going to have their enrollment period extended. I think right now there is not an end date. So if they didn't take care of it before December 7th, they can still do something on December 8th. They could still do something on January 1st because they missed their election period. So there are some options. But it's only about like 6 counties, like Hawkins. I think Hawkins is one of them. Sullivan, Cocke County, the ones that had the flooding from the hurricane. And the same thing's applying to those in Western North Carolina. They're going to be in the same situation. I'm not appointed in North Carolina, so that's not who I'd be working with. One of the things we've been doing, and actually I'm going to talk about that after the break. I've talked about updating, checking your drug plan. This year is and it's not just the drug plan, but it's also the drug plan that's part of your Medicare Advantage plan. I already had somebody that reached out to me yesterday, and I've got some other clients that I'm planning on moving, that they can stay with the same company, but they really should change their Medicare Advantage plan. Because of the Inflation Reduction Act, a lot of the Advantage plans have instituted deductibles on their Part D, on their prescription drugs. And also, even not just the deductible, but the zero premium plan may not be covering your drugs as well as another plan that has a small premium. And when I say small, it is very small. I can't say the company name, very strict on the compliance with Medicare, but if you think maybe you might need to change you may be very happy with the company you have, and that's what's really simple is we don't have to worry, we don't have to double check your doctor network, basically. If your doctors are in network with the one plan, with the zero plan, they're going to be in network with the plan that's just has a small monthly premium on it, but it's very affordable, and the savings on your prescriptions for a lot of people is going to be more than keep saving on your monthly premium. So if you have a plan, you should have got your annual notice of changes, and if if you're taking brand name, as I say, if you see it advertised on TV and you take that prescription and you have a plan that's going to have a deductible for Part D, you'll have that deductible. Now, that deductible does go towards that $2,000 max out of pocket, but if you don't have to pay $2,000, and that was the thing, that lady that I enrolled earlier this past week, she increased her premium, but she still was going to save about $1,000 a year. Because that's how much she saved on her drug costs. How they do that calculation, I still really haven't totally figured that out. But just to say, you can save a lot on your plan by raising, your monthly premium of a few dollars. It's not a lot. And when I say it's not a lot, it really is not a lot. I don't want to say the specific number here on air, but get with us and set up an appointment, and we'll talk about how to do all that after the break.
This is Marvin Long, your Twin Lakes Business Solutions Consultant. Every day and on November 11th, Twin Lakes celebrates our veterans, the ones in active duty, in reserves, or retired, and the ones who've made the ultimate sacrifice. Twin Lakes will forever be grateful for the home of the free because of the brave. In honor of all our veterans, Twin Lakes business offices will be closed Monday, November 11th. Take the time to thank a veteran, not just today, but every day.
Looking for incredible deals and unique finds? Discover the Habitat Restore off South Jefferson in Cookeville. From furniture and home decor to appliances and building materials, we've got everything you need to spruce up your space, all at unbeatable prices. Plus, every purchase supports Habitat for Humanity. The Restore is also hiring. Approximately 30 hours per week, must be able to work Monday, Thursday, and Saturday and lift 50 pounds. Questions, please email restore@uchabitat.org. Habitat Restore, South Jefferson Avenue, right here in Cookeville.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, welcome back. As I mentioned, I was talking about how to set up some appointments and get some of the information we need to us. If you listened last week, I talked about how we have to have, CMS requires us to have a consent form to act on your behalf on the healthcare marketplace for the ACA plans. CMS also requires us, we've had this form for years. They loosened up the requirements of it a little bit a few years ago, and now they've reinstituted the 48-hour rule, and that's what I'm talking about. It's called the scope of appointment, or sometimes when we type it out, we'll just abbreviate SOA. If you don't know what scope of appointment is, SOA is not going to mean anything to you. But anyway, we're using a program called Retire Flow. It's a subscription that I'm paying extra for to help us streamline our intake process. And even if you're already a client, it's important for you to sign that form for me. If your drugs didn't change, I probably do have a copy of your drugs, but you would be surprised. I might be like, yeah, mine are all the same, and then they send it in, and what I had down for last year is not exactly the same. They've replaced a certain prescription, or they were taking 40 milligrams, now they're taking 50 milligrams, and a lot of times that's not going to make a difference on what the drug is going to cost, but it's very critical. The other thing but anyway, on Retire Flow, and it's really simple. You can do it on your phone. You can do they call it an online survey, and we send you a link. You go to that link, and it's going to ask you, to type in your name and actually it doesn't ask your birthday, but it's going to type in your name, your phone number, your address, your email address, and then it's going to start asking you questions. I think it's in the order to ask you about your prescriptions, or it may ask you doctors first. I can't remember. I did one myself, and now I don't remember which order it came in. But on the prescriptions, it's very helpful, because you just got to type in the first few letters of your prescription, and then it'll pop up with the suggestion, and you can click on it, and then it's going to ask you for what dosage you take. Be very careful. Make sure you're picking the right one on that. One of the ones I had the most issues with, but it's one I know that one to pick it up, but I even make the mistake myself, is levothyroxine. That's the medicine for those that have low thyroid. It comes in a capsule form and in a tablet form. I have yet to meet anybody who takes the capsule, but when you're looking at the list of prescriptions, capsule comes up first. And so if you're looking for 125 micrograms and you scroll down the list and go, click, oh, there it is, but you've clicked capsule instead of tablet. And then when we do the search, it's either going to come up as not on the formulary or it's ridiculously expensive. And it's like, wait a minute, thyroid's not that expensive. Why is that not? And then I went, selected capsule, not tab. So that's one of those ones I know I can go correct myself. But there's some other prescriptions out there that are, there's a 50 milligram tablet, there's a 50 milligram capsule, there's a 50 milligram capsule extended release, all those little things. You got to make sure you pick the right one. And what I found, sometimes the tablet's covered, but the capsule isn't, or the extended, or the regular dose or regular time release. You don't have the extended release on the capsule. It'll be covered, but the extended release is not on the formulary. Or it's on a much higher tier. So it's very critical that you pick the right one, so that we make sure that when we're shopping for your drug coverage, that we're picking the right plan for you. And I talked about this a couple weeks ago, but I'll use it again. I've got a client that takes both Xarelto and Xarelto and Jardiance. Both name brands, like I said, you see them advertised on TV. Used to say, expect to hit the donut hole. Great news is there is no donut hole for 2025, and there's a maximum out of pocket. But for this individual, it's saving him, I think it was close to $300 or $400 a year to get a drug plan that costs $95 a month instead of getting the drug plan that costs $27 a month. So just because that premium may be low doesn't mean that's going to be the right drug plan for you. And especially extremely low bargain plan, you definitely want to make sure that all your prescriptions are covered. And again, if you take a blood pressure, lisinopril, losartan, you take simvastatin or rosuvastatin, yeah, those are cheap drugs, and you probably could get away with the cheapest drug plan and be fine. But when you get into some of those more expensive prescriptions, especially the brand names, Eliquis, Jardiance, Trulicity, Ozempic, all those big names, they may not be on the formulary for that bargain plan. And so now, and there's no $2,000 cap on a plan that's not on for a drug that's not on the formulary of your drug plan. So it's very important to make sure you pick the right drug plan. And the other thing, as I mentioned, the term SEP, Special Enrollment Period, if you don't qualify for an SEP and you didn't make a change on your drug plan during this time now, during the AEP, come January, February, and you realize that your drug isn't covered, you have to wait till this time next year to change your plan for January of next year. So it's important to review that drug plan, and that's something we can do very simply. And anyway, I mentioned that retire flow, so it's going to ask that, and it's going to ask for your doctor's name. Please be sure you're spelling your doctor's name correctly when you do that, and first and last name. And specialty actually helps, because if your doctor's John Smith, I don't know which John Smith it is. Or if you say, I go to Dr. Peters, no first name, no specialty, there could be 5 doctors that come up with the name of Peters. I don't know which one it is that you're wanting to make sure is in network. So be a little more specific. There's never such thing on this form of too much information. The more information you can provide us before your appointment, the more prepared we'll be to make sure that we can make the suggestion for the best plan. And then the last part is the real critical part, is that scope of appointment, that SOA that I have to have 48 hours prior. Now, if you're coming to our office, we can have you sign one in place because you are a walk-in. You voluntarily came to the office and said, help me with my health insurance. If you're scheduling for me to call you later or set up a video conference, which is my preferred way if you can't come in, we can do it over the phone, but I can talk just like I'm talking now on the radio. I know everything I'm talking about, and you're maybe not catching half of it because you don't see the things I'm talking about. So that's why we prefer in-person, and the second best in-person is the video conference, because I can share what I'm talking about. It makes so much more sense when you can see, when I compare, well, this one's this much, this one's this much, and you can see the comparison between the two. So it comes in very handy to do that. So we do need that form 48 hours before doing those appointments. And even if you're going to come in, it's still nice to have that already on file and we're ready to go. And it gives us that information to prepare the best plan for you. And sometimes I've had ones, like I said, that capsule or tablet issue that I've had to clarify and find out, oh, no, that's not the one they're taking. And usually the first red flag that I know that I probably have the wrong drug listed, because if you're already my client, you're already on a plan with a certain company, and you haven't complained about how much it's costing you, you probably put in one of the other ones than actually what you're taking. So that gives me that opportunity to kind of figure those things out before we have the appointment. And it speeds it up. And a lot of times, if you're just wanting to say, hey, I just want to know if it makes sense, should I think about changing plans or just keep what I have? And a lot of times can just say, look back, and check back and say, oh, I looked it over. If you don't have any complaints of the plan you have, you can just stay where you are. You're fine there. So, and that could save us both some time, and it gives you that peace of mind. And we'd like to get that as early as possible. That's why we ask for people to, get that information to us at the end of September, first part of October, because we can look all that stuff up the first 2 weeks of October, but you can't enroll anybody. So we can review all that stuff, and then on the 15th do the enrollment. And that's what we're doing now. We're doing all those enrollments. So again, I said this on last week's call. I don't think I said it today. When you call the office, you got a question, just tell them what your question is. They'll either relay the question to me or to Kalia or Bree if you've worked with them. One of the things I forgot to mention during my open enrollment, ACA enrollment call, is like I did last year, I kind of focused on Bree and Kalia doing most of the ACA open enrollments. I'm the one with the most Medicare experience, and so I can focus a little bit more on my Medicare clients, and they take care of, and even, don't feel I don't want to work with you, and you'll be in good hands if I ask Brea or Kalia to handle your re-enrollment. That's one of the reasons why I've hired staff, is to take some of the workload off of me, and it does help a lot. If they feel like they're getting stumped, they'll come to me, or they'll tell you, okay, I've got this. Matt's in an appointment with somebody. I can't ask him, but I'll ask him when he gets out, and then I'll call you back, and we can go on from there. So you're still getting my service sometimes by proxy, but you're still getting great service. And I think some of the people, once they get to know Kalia or Brea, they'd rather work with them instead of me anyway. So, my staff is great. They're going to, and it doesn't matter who answers the phone or who you talk to if you're scheduling an appointment. They're going to ask you to do these updated forms. They're going to send you a link. Retire Flow is great. We can send it to you as a text, and you can do it right. And I had a lady recently that, she was just, deer in the headlights, because she had come into the office to talk about setting an appointment. And I said, yeah, and if you could fill this out before you come in, it would be helpful. And she was like, I don't think I could do it. About an hour later, she had submitted her form, and she did fine. So it's actually one of those easy things. If you're texting at all or doing Facebook on your phone, you should be able to fill out that Retire Flow form and get it to us. And the other thing on the scope of appointment, make sure you put your initials in all 5 boxes of things to discuss. Even though maybe you think you only want to talk about your drug plan, we may still, if you have a Medicare supplement, you might want to switch to an Advantage. Or if you have an Advantage, you may want to, and you may want to talk about dental and vision. Just initial all those boxes. There's no commitment there, but it is important that you initial those boxes and that you sign it. And it's all done electronic. I don't think you don't even have to do like your finger thing. You can just select the type of signature you want to go on there. And so it's pretty simple, and it just saves a lot of time if you can get that to us ahead of time. I was going to talk about plans F, G, and N. I'm about out of time. But if you were eligible for Medicare prior to 2020, you can have an F plan. And if you have an F plan, that premium's probably really gone up really high. You might want to look at a G or N plan. The only difference between G and N is G has the Part B deductible. In Plan N, you have the Part B deductible and a couple of copays for like doctor visits, but that's the most affordable plan. And if you hardly ever go to the doctor, that's definitely going to be more affordable than an F plan. And if you're still healthy enough to change, we should look at that. You don't have to do it right now. You can do it any month of the year, but usually people are looking at that because they're also looking at their drug plan. So I'm about out of time here. Don't forget to go to insurancematchmaking.com. And until next week, we'll see you on the radio.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.